All right, so we are already recording. So want to welcome everyone back to our Compassion and Resilience Education at Work. Today's topic is stress management, and I'm going to pass it over to our speakers for today, Angelica and Patrick.
Thank you so much, Wendy. Good afternoon, everybody. Thank you so much for joining us. This is our Compassion Resilience Education at Work, our second session on stress management. And so we are going to just go ahead and get started as we have a few kind of joining us as we talk. Just so you're aware, we are from the University of Florida IFAS Extension. We are basically part of the university system. If you have any sort of issues with discrimination, you could always feel free to reach out to USDA. So these are the two speakers that we have for today. So my name is Patrick Zayas, and I am an extension agent for UF IFAS Extension in Orange County. I'll turn it over to Angelica.
Hi, good afternoon. I saw in the chat somebody was having difficulty with their sound. You're working on the audio. Okay, awesome. Just wanted to clarify before I continue. But hi, my name's Angelica Keene, and I work for the University of Florida Extension Office in Brevard County. I am the community development agent, and my area of expertise is building community capacity, specifically in the area of mental health. So I have been working in that field now in the total field for about 15 years. So thank you for joining me today.
Yeah, thank you, Angelica. And just to add a little context, I am a family consumer sciences agent. I focus on mental health and also physical activity, nutrition, food systems, just kind of any of the things that might affect somebody's overall well-being, specifically in the Orange County area of Florida. We are faculty at UF. We just work with the community rather than students. If you are attending any of these trainings, you may have seen our other coworkers, Wanda Adorno and Hillary Ayers. They're also leading a few of them. So if you joined us on Tuesday, or if you join us next week, you will see them. But they're not with us for today's lesson. They have other educational programs going on. But Wanda and Hillary are also helping us out with this series of educational sessions. All right, so let's get right into it a little bit. Let's talk a little bit about what we are going to be talking about today with our agenda. So we do love always to begin with a little bit of an introduction. We want to learn about you all and who's here. It also helps to ground our conversation and maybe some experiences you've had before. After that, we are going to go over some terms and definitions. It's really good to make sure that everybody has the same understanding of some of the terms when it comes to stress management, but really when it comes to resilience education as a whole, making sure that we know the correct terminology for what it is that we're going to be discussing. Then we're also going to look at identifying stress triggers, what those things are that cause us stress. We're going to work on identifying them, and then we're also going to move into some management and coping techniques to help you give you some ideas on ways that you can kind of work through those stressful situations. Our objectives for this session is to teach the terms and concepts related to personal stress. Like I said, we're also going to include some activities that individuals can use to respond to and manage stress, but ultimately we want to give you a better understanding about stress and how to work through it. So we are teaching compassion, resilience, education at work. So this is a CREW. It's called CREW. It is a curricula developed by Purdue University Extension. Like I said, this is a series of 3 sessions. So this past Tuesday, September 3rd, we had work-life balance. Today, we are doing stress management. And then next week on September 10th at 12 o'clock, we're going to be doing stigma reduction. So if you haven't signed up for that one, please feel free to sign up and come join us. It's going to be a great session to kind of wrap everything up, but I think all of these have really important and valuable information in them. So we do want to start by discussing a few things about what this session does and does not cover. So this session includes health education meant to inform. It is not meant to diagnose or treat specific medical conditions. The content is not meant to replace recommendations and treatment a person may receive from a healthcare professional. This is purely educational. Some topics may bring up different thoughts and emotions. Some topics may challenge your viewpoints. I want to give space for the wide range of experiences and differences that people bring here today. If you need to step away at any point, feel free to do that. If you have to take care of yourself, by all means, go for it. Sometimes, these concepts and these discussions can bring up all sorts of different emotions. So feel free, take a step away, do what you need to do to take care of yourself. While I want this session to be as useful for you as possible, today's topic does have limitations. I want to recognize that ways to manage stress may vary from person to person. So just kind of keep that in mind, that some of the things we talk about may work for you, but it might not work for everybody. Or maybe some of these things you have tried before and they didn't work. And that's okay. Everybody is different person to person. And so you all might have different reasons that you're coming here today, might be required or might be interesting to you. But that said, this session does rely on active learning from one another. So, if you are joining us, we really encourage you to participate actively. Feel free to, tell us about yourself in the introduction, and feel free to share things that have worked, or if you see something that hasn't worked, or, just kind of your experiences. We love participation. Listen to understand, not just to respond. So, when we are talking, listen to kind of understand these concepts. Remain open and respectful towards others' ideas and views. And of course, we want to be mindful of using suitable language, and do not mention employee names when talking about a situation. Don't call out others. We love experiences. But if you do want to share a story of some sort, please don't identify anybody in your story, just so that way we can keep it private. All right, so let's get started with some introduction. So great, I saw Patricia threw the participant guide into the chat, which is fantastic. Thank you so much. So we do like to begin with introductions, just kind of touch base and learn a little bit about you. So if you would like to type these in the chat, go for it. We'd love to see it. If you want to raise your hand and come off mute, that's even better, because we'd love to hear from you as well. But we really want to know, what is something that brings you joy? So we are talking about stress management. Stress is difficult. It can be challenging. It can bring all sorts of emotions out. So just to kind of ground us in our conversation, we want to begin with, what is something that brings you joy? Kind of the opposite of that stress. Really figuring out what brings you joy is going to help through those stress management situations. But go ahead, type in the chat, or like I said, feel free to raise your hand and come off mute and share with us the things that bring you joy. I'll go ahead and get started as you're coming up with your answer. I would say the one thing that brings me joy is exercise. Like I said, I am, that's kind of my background. That's my expertise. Whenever it comes down to it, maybe the first 5 or 10 minutes of any sort of exercise, I am not having it. I'm a little struggling, or, not really there. Very much extrinsically motivated. So it's hard to get me going. But once I do end up like going for a bike ride or a run or something like that, it really does bring me a lot of joy. So I think that is probably the key for me. I do see a bunch of comments in the chat, so I just want to bring attention. Obviously, dogs, cats, pets, they could definitely bring a lot of joy. I love the comment about gardening and mountain biking. I haven't really done a lot of mountain biking myself, but gardening especially really does bring me joy and is a great stress relief. A lot of family, right? Infant grandsons, spending time with daughters, snuggling up with animals, music and dancing. So thank you all so much. I really appreciate everybody sharing. I just want to share a few of them. But really, when we talk about stress management, we want to start with kind of what brings us joy. Keep that in mind as we're going throughout this training session, because stress can be temporary, right? So I'm going to go ahead. We're going to transition now into management terms, and I'm going to go ahead. I'm going to turn it over to Angelica.
Yes, thank you, Patrick. And thank you, everybody, for sharing the joy. So kind of flipping the script, what brings us joy? There are also aspects that bring us stress. And so to kind of frame our conversation, like Patrick said, we first want to kind of define the terms. But before we give you what those terms are, we want to do a little activity to let you guys think through, how do you guys use these terms? So what's going to happen in just a few moments, we're going to add you into breakout rooms. And in the breakout rooms, what I want you guys to do is you're going to discuss these terms with 3 very specific questions. So before we move on, if you don't mind taking out a sheet of paper, a notepad, or something like that, and then writing down these terms. So we've got stress, wellness, stressors/triggers, stress management, and mental health. So those are the terms that I want you guys to discuss in your breakout rooms. And what we're going to ask you guys to do in those breakout rooms is answer these 3 questions. Question 1 is, what do these terms mean to you? So you're going to be in groups about 5 to 6 and just kind of discuss, what do you think these terms mean? Okay, that's question 1. Question 2 is, are these terms positive or negative? Which one's what? Is it a positive term, a negative term? Can it be both? Something to think about. And then question 3 is, how do these terms impact your health and or the health of your community? So basically, I want to know, what is stress? How does stress, wellness, stress management, and mental health, how do they all impact yourself as well as your community? So before I divide you guys into breakout rooms, does anyone have any questions about what we're going to be doing? This is the time to drop it in the chat. All right, welcome back, everyone. I hope you guys I was able to pop in just real quick to kind of touch base and kind of see some opportunities of what was being discussed. And you guys had a lot of robust and good conversations going on. So I posed to the group, would any group be willing to share either a terminology or how these terms impact their community? If you would, you can go ahead and just unmute yourself and share for the group if anybody would be willing to do that. Again, you don't have to, but it's just an opportunity for us to really kind of connect. And the more we have conversations in and around stress management, mental health, and we normalize those conversations, the easier they become and the less difficult they become.
I'll share a little bit with our group. We didn't get through all the questions, but as far as like what it meant to us, and kind of going through the different levels, it seemed like, the wellness, it was looking at, like your healthy, positivity. But then again, when you got to triggers, it seemed like we had a lot more triggers than we had like the positives. So, triggers could be family, work, events, rudeness, anything like that. And then like management, we had one person who said, kind of walk away, different strategies that way, get out into nature. So that was kind of one of the things. It seemed like half of us felt that half the terms were positive and half the terms were negative. Like, stress wellness kind of sounded positive. Stress triggers is negative. So it seemed like it was about half and half.
Yeah, great. Thank you so much for sharing. Is there another group that would be willing to share what you talked about in your breakout session?
Well, I'm from group 5, and what we came up with, basically, one of us was like, what these terms mean to us. It was looked at as a collective, and it all falls under self-care, regardless of whether it's stress. Stress can manifest itself as either good or bad stressors. And the big thing around it was self-awareness, knowing what kind of stress you're going through. Are you equipped to manage that stress? What your triggers are, and being self-aware about those so that you're able to address it in a way that needs to be addressed. And then the impact on the community, if you are not addressing your stress, the negative stress that is, it can impact the way you communicate with others. And if that's a collective thing in the community where there is no intervention for mental health, then it impacts the community in all forms, socially, economically. It could be a burden. But on one hand, it could be a good thing too. Somebody mentioned what part of their job, we were privileged to have a chaplain. A lot of what he encounters could be a stressor, in the sense that you're handling areas of people's lives that are very sensitive, delicate, and sometimes complicated. It can get heavy, but being able to alleviate them from that pain brings joy.
Yeah, and I think that's great. And thank you both for sharing, because it really does have that impact of that component of checking in with ourselves first and then kind of diving into how does that impact the community. And I love that you guys talked about that example of that what may be a stress in a moment might also be a joy. And that kind of goes back and forth to kind of this idea of this terminology and kind of how we're going to pace the rest of the course. Before I transition, does any other group want to share? And again, you don't have to unmute yourself. You could also just drop it in the chat, but I want to give one more opportunity if another group wants to share either by unmuting or just dropping their comments in the chat. But yeah, that was very well said. Okay, hearing none and seeing none, we're going to dive right into defining those specific terms, at which point I'm going to turn over to Patrick, and then that'll tie back into those coping strategies and those management strategies we talked about that you guys mentioned so eloquently.
I think you all really kind of nailed it on the head with those who shared, and thank you so much for sharing. A lot of these can be positive, a lot of them can be negative. It really depends on the situation, but stress is defined as the physical or mental response to an external cause. And really that key word in that is external. We'll come right back to that in a moment, but stress can be positive, it could be negative, it could be both. Ultimately, everyone is going to experience stress. Stress management is the umbrella term for both preventing and dealing with distress symptoms through the use of planned strategies and coping techniques. Like I said, we are going to talk a little bit about some coping techniques, but we can say that stress management is a life skill, and using those planned strategies can help alleviate stress when it comes about, and then using the coping techniques will help lower stress when it is occurring. Wellness is going to refer to a person's attitudes and the health decisions that they make that impacts their health behaviors. So wellness is two parts: a person reaching for the best in their body, mind, and spirit, and feeling successful in their job, family, and other settings in their life. So not just the physical or emotional wellness, but also spiritual. We went over dimensions of wellness in the second session. So if you didn't see that, definitely reach out to us and we might be able to get a recording of some sort. Mental health is an individual's emotional, psychological well-being, affecting how they think, feel, and act. Mental health is an umbrella term that includes different experiences on a spectrum of illness to wellness. Mental health can therefore include short-term stress or early signs and symptoms of mental health or substance use issues. It can also include diagnosable mental health and or substance use conditions. And we'll talk a little bit more about those in just a moment. Finally, a stressor or a trigger is a factor that contributes to an individual's experience of stress or distress. A stressor may be a one-time or short-time occurrence, or can happen repeatedly over a long time. The term stressor is often used to mean the same thing as trigger. They're kind of interchangeable, but ultimately identifying and understanding your stressors and triggers will then help you deal with them, or conversely, on the front end, plan accordingly. So I did mention a key term with stress being that it's external. So let's just compare real quick, stress versus anxiety. Generally, stress is the external cause, which could be something like taking a big test or doing a presentation for work or having a deadline, arguing with a friend, but it's generally some sort of external response, right? Usually will go away once the situation is resolved, right? Once you cross that hurdle, it might go away. Like we said, it can be positive or negative. For example, stress may inspire you to meet a deadline, or it may cause you to lose sleep. Sometimes we may want that stress to kind of get us across the line, but other times you really want to be able to relax. So just to jump on the other side, conversely, anxiety is an internal response, meaning the reaction to the stress. Right? So we're talking about the internal environment now. So it's usually going to involve a feeling of worry or dread that does not go away, and that interferes with how you live your life. It can be constant, even if there's no immediate threat. So I know a lot of times people think about like the bear analogy, like if there's a bear outside that's going to attack you, how would you react? Right? You'd probably run away, scream, yell, anything like that. So anxiety is like that bear is out there ready to attack you, but there is no bear. You go outside and you feel that fight or flight, but there is no actual threat there at that time. Both stress and anxiety can affect your mind and body. You may experience symptoms such as excessive worry, uneasiness, tension, headaches, body pain, basically the physical manifestations of that stress and anxiety. So sometimes we use these terms interchangeably. I'm stressed or I'm anxious, but there is a difference. Stress is really that external response, and then anxiety is that internal response to the external stress. We also did touch on a little bit about substance use. So it is really important to kind of touch on the spectrum of substance use. So people use substances such as controlled and illegal drugs, cannabis, tobacco, nicotine, alcohol for all sorts of different reasons. They could be medical purposes, personal enjoyment, religious or ceremonial purposes, could be just to cope with stress, trauma, or pain. Substance use is different for everyone and can be viewed on a spectrum with varying stages of benefits and harms. And that's what this kind of does, gives you a visual when it comes to the substance use spectrum. So the stages are basically non-use, or what we know as abstinence. There is beneficial use, there is lower risk use or non-problematic use, there is higher risk use or potentially harmful use, and then at the end of it we have addiction, which is the complete opposite of abstinence. And that is the substance use disorder, which is addiction. So non-use is avoiding the use of substances altogether, which is abstinence. So not using any sort of drugs, tobacco, alcohol. Beneficial use is use that can have positive health, social, or spiritual effects. So for example, taking a medication can be a prescribed medication can be a beneficial use because it might help alleviate pain or something like that. So we do have substance use that does fall in the beneficial realm. Lower risk use has minimal impact on a person, their family, friends, and others. So for example, following the low risk alcohol drinking guidelines, right? Drinking alcohol is pretty common, but if you're following it in correct guidelines, limiting consumption, it could be a lower risk use. Higher risk uses are ones that have harmful or negative impacts on a person, their family, friends, and others, including this could be like binge drinking, impaired or drunk driving, use of illegal drugs, increasing quantity or frequency of use of drugs, or combining multiple substances, right? So that's when we're starting to get into the problematic realm of substance use. And then finally, at the very end of it, we have addiction. It is a treatable medical condition. It's also known as substance use disorder. It affects the brain and involves compulsive and continuous use despite negative impacts to a person, their friends, families, and others. So if somebody's at that point where they cannot physically stop using a drug, tobacco, alcohol, or anything like that, that's when we would say they're kind of more in the substance use disorder. Just a few notes on the spectrum. These things have different effects on people. So it's not always going to be the same. Things like, your gender, your age, your weight, your tolerance, all those things can really affect how substances affect you on the spectrum. The best way to avoid any harms from substance use is to avoid use altogether. However, many people use substances without causing significant harm to themselves or others. In some cases, substances have a serious risk of harm at any level of use, right? So children, young adults should be abstaining completely. So just to wrap up, if you do find yourself or somebody at the end of that spectrum and the substance use disorder, just know that the path to recovery from addiction is possible, but it looks different for everyone. So some people may benefit from non-use, which is abstinence. Other people may need counseling, medications, withdrawal management, all sorts of different things. We are going to have a little chart of resources at the end of this presentation. So if you do want to take a screenshot, if you need any sort of support, feel free at the end of this presentation, you could do that, or reach out to a medical professional to talk about this a little bit more. But it is important to just kind of touch on substances and the use as a spectrum. Along the same lines, it's important to talk about the stages of mental illness. It is often one of the most difficult things to detect, especially the first stage. These symptoms are easy to write off because generally people view them as quirks, right? They're mild symptoms or early warning signs. It might be, somebody withdrawing from friends and family, or beginning to show a decline at work or school, or exhibiting a greater desire to isolate and be alone. But ultimately, the first stage is going to have mild symptoms, warning signs. It can be kind of difficult to notice. The second stage is going to be when an individual's symptoms can become more pronounced and visible, right? So during this stage, the person may become more likely to attempt to cope with their mental health via self-medicating practices. This includes using alcohol, drugs, anything to deal with one of the issues that they might have happen. Stage 3 is when the symptoms of mental illness start to become so severe that they impede daily life. So this doesn't just affect the person struggling, it can affect anybody that's around them, family, friends, coworkers. These people in this situation might face significant disruptions to their daily lives. It is at this stage of mental illness that a lack of intervention becomes damaging in the long term. So this makes it really critical to seek help, for an individual who is at that stage 3 when symptoms are worsening and they're occurring more often. Finally, the fourth and final stage of mental illness is the most severe. It occurs when an individual's mental illness becomes life-threatening. It is during this stage that self-harm becomes the most likely issue that they're facing. Additionally, aggressive behavior towards others and lashing out at situations also becomes more frequent. As stage 4 progresses, the potential for suicidal ideations escalate and may result in attempts. So this is why we consider it the fourth stage when it comes to mental health. While it can be crucial to seek help at any of the stages before this, it is pretty much life-savingly critical to get help during the fourth stage. So again, we share this to kind of touch on some of these things we've talked about in passing, but mental health, understand that there are stages to it. Substance use, same thing. It's more of like a spectrum where you can be at different points, but ultimately both of them do have solutions to getting the health conditions resolved. So I'm going to turn it back over to Angelica to talk a little bit about identifying our stressors.
Thank you, Patrick. So now that we're familiar with kind of the terminologies around mental health and substance use, it's imperative that, like we talked about, that we're in those early stages, that we're checking in with ourselves too. That can be, we talked about it from the lens of how that might impact others around us, but also being mindful of how that might impact us. And so the Mayo Clinic talks about the fact that managing your stress really starts with identifying what are those triggers and what is it and why that is making you feel the way you do? Because it can look differently. As the example we talked about earlier, in one situation, it might be stressful, and in the next situation, it might be bringing you joy. I saw in this something that brings you joy, students with those aha moments, but also teaching can sometimes bring you stress. And so it's just understanding where are those stressors and where do they rank in the time frame. So one tool to use to do that, to kind of check in with yourself, is this stress trigger identification tool. So we've got it on this screen. It was also provided to you in your workbook packet. So you have the opportunity to kind of work through this, like not just now, but on your own time. That's a great question. So yes, it is absolutely one of those things that you can work through. We also have a poll that we're going to do right now that'll kind of guide us into discussion, because one of the things to think about is to be very mindful of the fact that a lot of times when we start to feel very stressed, you start to feel very isolated and alone. And for some, and for others, it's different. And so it's very mindful of just recognizing that, and recognizing what resources do you have at the opportunity. So we have a question in the chat, and it says, it is so important to be able to face, address, be candid with self and loved ones who seem to be progressing to more evident mental health disorders. It's hard to have intervention conversations, but critical and helpful to a loved one. And I just wanted to highlight that because I think that kind of ties everything together, what we're talking about. Is that it can be difficult to have these conversations, but they are so critical. And whether we're having them with ourselves or others, it's a great opportunity. So this is just one tool. So what we're going to do is we're going to pop up the poll here in just a moment. And I'd like you guys to go ahead and take a moment and rate the poll responses. Then let's go ahead and look at the, I don't know if you can select them, but let's go ahead and look at the work, one to start, and then we'll just kind of work our way through. So here is, we're looking at the results for the work-related stress. And as you can see, you're definitely not alone in this idea that work has a high impact on our stress management. And if we think about it, it does make sense because we spend a large majority of our time at work. And so our environments, working environments, can have a huge impact on that component around. And it also can lead to some of the coping strategies that we're going to talk about and how we choose to use which ones when. let's jump to, if anybody has any other requests of the specific areas, we can go ahead and jump right on to that highlighted. Yep, but let's just go ahead and jump to, I saw some pretty common ones in the money. We saw quite a bit of high ones, relationship, but let's go ahead and jump to the health specifically and share that one. Right. And the health one I just wanted to highlight because as you can see, this one was much more diverse. It was kind of all over from the not stressful to high stressful. And this is important to understand because to that piece that we've been talking about, you never really know what someone is experiencing. And so it's just important to realize what are you dealing with, but also what are those around you dealing with? And that speaks to Patrick, what we talked about when we started this class of coming into this with that open mind and sharing freely and having these broad discussions. And so this tool, to kind of close it and summarize everything, and thank you, Patricia, for sharing that poll. So if we want to go ahead and pull that back down, to kind of summarize everything and tie it back together before we dive into coping strategies, is just to kind of see that this is an opportunity for us to check in with ourselves. And it's also something that, you know, it can be a tool that you hand to somebody and say, hey, you know, I've noticed you've been a little stressed. Do you want to talk about it? Or and if they're not comfortable talking about it with you, maybe this is a resource that you provide to them to check in with themselves as well. So now we're going to transition to diving into talking about coping strategies specifically. Okay, so in our coping strategies, it's important to understand that just like our stresses are very different, so are the potential strategies. Okay, so it's really what works for one may not work for another. So if we have a little question that we're going to ask you and we want you to go ahead and put yourself, you can raise your hand if you're comfortable, or ideally if you just drop it in the chat. But how do you cope with stress positively? So before we give you some tools, we want to hear about the tools you guys already use. So if you could drop those in the chat real quick.
A lot of exercise and go for a walk. A support network. I love that. Sorry, didn't mean to speak over you.
Nope, you're good. I saw the same one. I was going, that support network was one that stood out to me as well. Yep. So yeah, that's great. Take a walk on the beach, video games. So what we've got on the screen here in just a moment is some of the common ones come up. Is that exercise piece that you guys so eloquently mentioned. There's that piece of meditation and mindfulness practice. There are your hobbies. I see a lot of hobbies coming up, whether that be music, snuggling with your pets, that healthy eating. So eating is one that is very something to be aware of, kind of thing, to how that works. That support group. I was so glad to see someone say that because our support network really has the opportunity to make a really positive impact, whether that be family, friends, or a more structured specific group. There's really resources in there. Kind of thing. So these are all just examples of what has worked for individuals. And I love to see them keep coming in about, like, that kind of ties back to that question we asked you from the beginning. What brings you joy? And you guys hit the nail on the head without us even having to tie it together, that what brings you joy is a potential opportunity as a strategy to reduce that stress. So we're going to dive a little bit more specifically into this area of meditation and mindfulness. And to kind of give you some context, I'm going to pass it back over to Patrick.
Yeah, so thank you so much, Angelica. A few of the things that people mentioned were like things like breathing activities and healthy eating. And so I did want to just kind of touch a little bit on mindfulness, because a lot of this can be categorized as mindfulness practices. And so a lot of times people conflate mindfulness and meditation as being the same thing. And ultimately, meditation is a formal mindfulness practice, right? And so I just want to give you a little bit of a background on what mindfulness is, because it took me a long time personally to figure out what exactly am I doing when I'm doing a breathing activity. So ultimately, when it comes to mindfulness, you know, we're trying to think about living in the moment, right? And so if we're trying to think about living in the moment, we have to focus on something that is a constant in that moment. The thing that is a constant in that moment is called the anchor. And so that is the focal point that reminds us to return to something in in the present. And so the anchor could be all sorts of different things. So if you're sitting out on a park bench, just kind of enjoying the weather, your anchor could be the feeling of the sun on your skin, right? You just kind of in that moment, you really focus on that sensation, that feeling, and you kind of let your other worries kind of fall by the wayside. And you just focus on living in that moment by the sensation of the sun on your skin. You can also do mindful eating, right? Where you start to eat something nice and slowly, and your sensation, your constant is the flavors of that food. And so you're focusing in on it. When it comes to breath meditations, your anchor, your constant is your breathing. So when we say to focus in on your breathing, you are consciously focusing in on the idea of the air coming into your lungs, coming out. You could be focused on the sensation you feel as the air comes in, or the sound, but ultimately your anchor could be all sorts of different things. If you don't like the breathing, it could be mindful eating or listening, but you want to have a constant anchor. And so these are just some mindfulness practices from a mindfulness activity guide that we have. So like I said, breath meditation focuses on your breathing. We're going to do a quick breath meditation here in just 1 second. The stop meditation is really stop whatever you are doing, take deep breaths, observe your thoughts and emotions, and proceed with whatever you are doing. So again, it's just kind of cueing ourselves to stop. A rain meditation is called recognize what's happening, allow life to just be as it is, investigate inner experience, non-identification. So these are just little acronyms, but ultimately all of these are mindfulness activities. And like I said, when it comes to mindfulness, you're really just focusing in on something that's a constant around you, right? You're not trying to not think about anything at all, but instead focus at attention on something. And if you notice your mind is wandering away, come back to whatever it is that you're trying to focus on. So just to put this into practice, I'm going to turn it back over to Angelica to lead us through some square breathing.
Okay, so this is that participation point of our course where we hope you guys will participate, but there's no active way for me to know or not. So I'm going to trust you guys. But what I'd like everybody to do is go ahead and get a comfortable seated or standing position, whatever fits best for you. And we're going to do something called square breathing. And it's exactly what it sounds like. We're going to breathe in a rhythmic of a square. So meaning that we're going to breathe in for 4 counts, hold for 4 counts, out for 4 counts, and hold for 4 counts. So that's that anchor piece that he talked about, is that breath as well as that counting. So what I'd like everybody to do is just take a nice big deep breath. Inhale for me. Exhale, let it out. Close your eyes if you're comfortable. And we're just going to inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4. Inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4. Inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, and hold, 2, 3, 4. Now I'd like you to take a few more of those breaths, but this time counting at your rhythm of breath, still in that same 4 count pattern. Okay. What I'd like everybody to do is just finish whatever round of breathing that you're on, finish that cycle through, and then go ahead and open your eyes and come on back to us. So that was just one example of a breath work, and breath work is great because it's something that you can do in any moment without someone even recognizing. And if you don't want to close your eyes, a good strategy is just to kind of soften your gaze. It'll have a similar system response without having to close your eyes if you're uncomfortable with that. So I hope you guys enjoyed that activity. We have some more resources that we're actually going to dive into and introduce you to. And the first is I'm So Stressed. And the I'm So Stressed is just kind of a handout that comes in your guide that we gave you. It talks about kind of what overview of what we talked about as the lesson today, as well as kind of the breakdown that Patrick gave of stress versus anxiety. So
there are some other ideas for coping with stress and anxiety on the backside of this sheet, so feel free to take a look at those. There's also some really good information about recognizing when you need more help, and some resources for if you do feel like you're struggling, or if any of the things we talked about kind of cued in with you today as things that you want to seek help for. So just to kind of wrap up what we've talked about, we began today just by doing some short introductions, talked about what brought us joy. We went ahead and went over some terms and some definitions, things like stress management, wellness, stressor triggers, mental health, all sorts of different terms that are really common within this space, but a lot of times we don't really take a moment to define them. Then we walked through identifying some stress triggers. That was the sheet that you all have to identify those with a 1 through 5 scale, and then stress management coping techniques. So, something like a breath meditation is something you could do anywhere, but there are other more advanced stress management coping techniques if you are really struggling, and we encourage you to seek a professional for anything above that. We did talk about there being some resources if you are struggling with, say, substance use or mental health issues. So these are some national resources. So if you do want to take a screenshot of anything, you may, but there are a lot of national resources out there if you are dealing with mental health or other substance use issues.
yeah, it's important to highlight here that these, again, are national resources. These was put together by CREW. So this is part of that resources. There are additional resources that Patricia has dropped in the chat regularly, but it's a really good tool to keep on hand to just kind of be aware if someone comes to you and they're experiencing or expressing early signs or symptoms, like we talked about, that you have the ability to refer them to the appropriate person, whether that be earlier self strategies like we've talked about with the breathing, all the way to professional care and kind of everything in between. And so here's just some opportunities for you. So that kind of wraps up everything we had today. Does anybody have any questions? And I know we also have a QR code on the screen. If you guys don't mind taking the moment to go ahead and scan that QR code to complete the evaluation. Evaluation data is so critical because it helps us know what to improve, but also what you learned. Remember, in the beginning of this course, we talked about the objectives was trying to provide you with that knowledge and information. So we want to know that we're covering what needs to be covered, and if not, what can we improve upon? So Patrick, do you have anything else to add?
I don't. I just want to acknowledge everybody's presence today and participation. Thank you all so much for taking some time out of your day to join us. I think just the fact that you're here shows that this is something that's important to you and it's important to us. So hopefully you either learned something today or maybe it was just a refresher, and that's fine too, just to kind of touch base. But ultimately, we are here to kind of help people's wellness and their way of life. So if you have any comments or questions or concerns, you can feel free to email any of us. We all work together. We can bounce it around, if we're in your area or whatever it might be, to have more personalized education. But I did just want to make one more comment that our next session is stigma reduction, which kind of wraps everything up nice and well. And that's going to be on September 10th, same time at 12 o'clock. So if you can join us, we'd love to have you and finish up this session, or the series, I should say, with that session.
Patrick, there was a question, or Angelica, on what the acronym RAIN stood for.
Sure. Yeah, I'm going to go back because that was one of our mindfulness practices. So RAIN meditation is a type of meditation. So RAIN and STOP are just acronyms, right? So RAIN stands for, the R is recognize what is happening. So again, you're just taking a moment to realize, like, when you're having this stress, what is exactly happening. A is allow life to be just as it is. So again, the purpose of mindfulness is really to kind of let things pass by, right? You're focusing on the moment because you don't want to obsess or dwell over things that are just kind of occurring around you. So taking that moment to allow life to be just as it is. The I in RAIN stands for investigate your inner experience. So how is this affecting you, your emotions, whatever it might be? And then N is non-identification. So kind of, we're not trying to be judgmental, right? We're not trying to say that this is wrong or this is good to have this feeling, whatever it might be. We're trying to be non-judgmental and just understand that this is occurring. It's occurring around us. This is how we feel about it. And we're just going to move on with life as it is. It's just kind of a way to kind of help relieve those stresses. But stop meditation, body scans, mindful eating, mindful walking, these are all examples of mindfulness practices.
Great
Some go-
questions. So with that, we're going to go ahead and bring everything to a close. Thank you so much for sticking with us today. Sorry we did go a minute over, but we appreciate all your feedback, both by the survey and in your responses. So I hope that everybody has a great rest of your day.